The entire debate today boils down to two words: who and why. Who is the best decider whether or not a child should be vaccinated? And secondly, why is the person the best decider given all the other relevant factors that we keep in mind, being the parents' ability to choose for their children, and secondly, any personal, religious or philosophical belief that the parents might have themselves. Before going on to show you the analysis of side proposition and why exactly that supersedes side's oppositions, let's look at the concerns that that DLO has brought about in this house today. His major concern regarding the harm of this policy is that there's going to be a distrust festered among parents as a result of this policy being passed. And where does this distrust come from? First, he speaks why parents will be afraid that their freedom has been robbed off of them by doctors, and secondly, why the doctor was allowed to take such a decision given there was no immediacy. Now, this needs to be tackled first and foremost. Why? Because side opposition seems to believe that doctors should only be given such a discretion over his or her patient's life, given that there is an immediate crisis at hand. Let's look at it this way. Why exactly do we go on giving vaccines that prevent these diseases from turning into an epidemic, or at least we try to reduce the risk of these diseases turning into epidemics, because we know they're preventable, because we know it is within our capacity to have ensured that in the last few days 1 to 2 children in USA did not die of measles, a disease that was thought to long have been eradicated. We believe it's absolutely unacceptable for side opposition to come up and tell us that given that there is no major crisis and given that there is no immediacy at hand, the doctors should not be allowed to do so. Not only are millions of dollars of public health at stake, but also lives of people which could have been prevented had the doctors acted upon their own instinct and upon their own judgment could have been prevented. We believe at the end of the day, it is lives we're saving. Secondly, they come up to tell us exactly why it will go this distrust will go on to harm the herd immunity we're trying to achieve. Maybe. But here's what we think. The moment doctors as a community believe in the philosophy that they should vaccinate their patients, we believe no matter which doctor these patients go to, this policy will have a high chance of being implemented, because that doctor will be willing to believe in that philosophy and will be willing to vaccinate that child no matter what. But the opposition's worst concern is that the distrust will go to such an extent that even when the child breaks his neck, the parent won't go to a doctor. If indeed that was the case, and if indeed the parents, even in such drastic situations, are unable to take a rational decision, maybe they weren't the best deciders of their child to begin with. But we believe that that's extremely unlikely to occur, and even if it does, then the injury of the child will not, and in any situation, will not be connected to that of the doctors, but the failure of its parents to take a rational decision when they ought to have. Moving on. The alternatives that side opposition brings to us is that why not educate people? Why not bring about social ads? Because clearly they're absolutely convinced that the public is gonna buy into the benefits of the vaccines and will change their beliefs, be it philosophical or be it religious. We believe the government has for years gone on to enhance these awareness campaigns, and despite that, people have been adamant. In fact, the extent to which parents' fear or paranoia has gone up is that they're willing to join any religion, even if they don't believe in it, just to ensure that they can qualify for an exemption of refusing to vaccinate their children. Now, we believe that these awareness campaigns have been unable to be successful merely because we've been unable to convince these parents as to maybe the benefits of vaccines or being able to trust their doctors to take the correct decisions for their children. Because they have failed is exactly why we believe doctors here are now should take up the work, because we've already seen why in USA it has clearly resulted in terrible harm for the children themselves. The last worry of side opposition has been that the entire FDA is corrupt, and the fact that these are only a committee of doctors who will go into multi-billion corrupt deals with pharmaceuticals at the end of the day will release ineffective drugs into the market which won't work anyway. Firstly, the FDA is regulated by the government, and I can see no reason in the entire debate today why the government should have any incentive to put the risk of thousands of lives of children at the risk of being vulnerable to these diseases. Because not only is the government's reputation at stake here, but also the doctors. We believe the moment these ineffective drugs are released into the market, there will be thousands of people complaining about why they aren't working. There's going to be a huge deal of media scrutiny of these drugs, and there appears to be no reason why the doctors and the government will be willing to risk their reputation and to risk the goodwill amongst people just because of $1,000, just because of a few $1,000,000. We believe it makes absolutely no sense. Now, moving on with our case and why it has been unable to be defeated by side opposition. We've given you a number of reasons as to why doctors should be the best deciders of these children. Firstly, we've shown you why these medical professionals have a degree of objectivity because they understand the concept of medicine, which is clearly absent in terms of parents. When parents were interviewed after the measles outbreak in California, a number of them said that in assessing whether or not they should allow their children to go for vaccines, they consulted a report that was published sometime in 1991 that has already been debunked and has already been said to be fraudulent, and yet parents went on record to say that, well, the report was inconclusive. We can't deny them, mainly because of the fact that they are concerned about their children to an extent that their fear has gone on to become paranoia, to an extent that they're absolutely unable to regard what is logical and what's not. Secondly, why doctors should be allowed to push forward for these vaccines is because the fact that they're regulated under FDA or CDC goes on to show that they can only prescribe and vaccinate these children with drugs that are approved by these bodies. And we tell you that why it's going to be very easy for any parent to prove in any court of law as to whether or not a doctor has been negligent, because we tell you that there's a clear list of drugs that the doctor can or cannot administer, and thus there are already filters to ensure that the doctor works honestly and competently. Secondly, even when parents come about with saying, even when we have to take into account factors such as the religious beliefs of parents, we tell you exactly why such a belief has to be is being outweighed by the disbenefit that it brings about in the wider community. There are people whose lives are going on stake because of a religious belief of a small community of people, and unfortunately, the government has to outweigh people's lives in comparison to that of somebody's religious freedom. On the question of a doctor, not only does he have a hypocritical oath to ensure that every patient who comes to him is given the protection that medicine allows, also he has a huge responsibility towards the community that he serves to ensure that that contagious diseases such as measles or rubella, they don't come about decades later merely because parents have been unable to rationally decide for their children. We believe doctors are the best deciders of your children, not because they owe responsibility to you, but to also the thousands of children that a unimmunized child can possibly affect. We believe at the end of the day we save greater lives, and we ensure greater quality of lives, and thus we're very proud to propose.